So let's start with fillers. You do a lot of fillers in your practice, and I guess how fillers are normally done, they're injected with needles, like in nasolabial folds, under the eyes, temples, things like that. You don't like the standard injection. You use a cannula. So why is that, and what's the big advantage?
So with a needle, when you inject the fillers with a needle, you have the increased risk of bruising. You have increased risk of nerve damage, especially when you go in an area where you shouldn't be with a needle. So with the cannula, because it's round at the end and it slides under the skin, so any little blood vessel, little nerve, it just kind of pushes it out of the way.
Okay.
And so I can reach with the little cannulas areas that normally I wouldn't go with a needle. So temples, really great. It's like, especially you pull your hair back, short hair.
Like
you
areas
can
right
totally see it when it starts to look skeletal. and
Fillers along this area now?
Yes. So the fillers in there with the cannula, it's very safe. Kind of be gentle, and it totally restores the volume, restores that youthful fullness that we lose as we age. And also by restoring the volume in here, it also gives a lift on the eyebrow because you pull the eyebrow up. So it opens up the eye a lot more. Also go in the back of the face, kind of to lift everything and restore the volume. And again, I wouldn't go in this area with a needle because of the risk of.
So is a cannula, you know, I think of cannulas for liposuction, right? So it's bigger than a needle. Does it hurt more?
It's not bigger than a needle. It's actually about the same size with a needle. And so it doesn't hurt. So that's kind of the paradoxical. It's like you expect it to hurt. The reason why it hurts when you use a needle is because you cut with a needle through little nerve endings.
Okay.
With a cannula, because it slides, there is no nerve damage, even like microscopic nerve damage. So there is no nerve damage, and you can, by just sliding, at the most, the patient will feel a little bit of pressure.
So is it a better delivery system of the filler itself?
Wait.
When you go in with a cannula?
It's way better. It's safe. You don't have no bruising, so that's better. And swelling, because you actually do not damage the tissue when you go in with a needle. You don't damage the tissue.
So if what you're saying is true, why isn't everybody doing it this way? Because there's a lot of people in the filler business. Why aren't they all using cannulas? Help me understand that part.
Well, for starters, it's a ramping process of learning how to do it. So it's the training that you kind of have to go through. And it takes longer kind of to do it. You have to pay attention to detail. And with the needles, it's a lot faster. But also with the needles, you have increased risk of bruising.
Okay.
Also with the cannula, it's a lot safer because you don't have the risk of nerve damage. And also the access with a cannula, it's a lot better than what you have with the needle, because you can lay a blanket of product under the skin that will give a more natural, youthful result than when you go in with a needle and inject it straight out under the skin. Another benefit to the cannula is because the way we lose volume as we age, we lose volume in the temples, we lose volume on the side of the face, so everything falls forward. So when I use the cannula in the temples, there's a big artery, so it's really, really safe to go with the cannula in the temples to restore volume with the fillers.
Okay.
On the side of the face, also because of big blood vessels and salivary glands and big nerves coming to the face, it's safe to go with the cannula because that you can restore volume on the outside of the face and lift.
Okay.
If you use a needle, a needle wouldn't be safe to go on the outside of the face. So usually with a needle, if you do the fillers just with a needle, you just kind of do the front of the face. And that's why a lot of the patients, when you look at them and they smile, they're heavy in the front and totally empty in the back. So with cannula, I feel confident and it's safe. That's the main thing. And what's nice, kind of using the cannula, because you put the volume in the back, it actually gives a more youthful look than when you just use the needle in the front of the face. And the patients look a lot better and more rested. And actually, I had a patient that I did the fillers on her. She was gone, comes back 4 months later, we do some Botox. She goes, okay, before we start, I need to show you this. I had my driver's license renewed after you did the fillers. And look, I look better now than I did 10 years ago. Okay. And it's like, we all know, we never look good in our driver's license pictures. But she looked more youthful because of the volume that was restored kind of in the back. And her face actually looks skinnier. And some of the patients, they're like, did you lose weight? It's like, no, you just kind of got some filler in the back and lifted everything.